Imagine a weight loss medicine that works like Wegovy or Mounjaro, but comes as a simple pill instead of an injection. Sounds revolutionary, right? Well, the FDA has now approved Foundayo, also known as Orforglipron, and experts say it could completely reshape obesity treatment worldwide. Today we're discussing one of the biggest medical breakthroughs of 2026, the approval of Foundayo, a new oral GLP-1 medication for obesity. We'll also talk about how Foundayo works, how it compares with Wegovy and Mounjaro, why doctors are excited about GLP-1 medicines, their possible heart health benefits, and the growing concerns about cost and side effects. Let's begin. Foundayo is the brand name for a medicine called Orforglipron. It was developed by Eli Lilly and approved by the US FDA in April 2026. What makes this medicine special is that it's a GLP-1 receptor agonist in pill form. Until now, most powerful GLP-1 medicines, like Wegovy and Mounjaro, required injections. But Foundayo is taken once daily as a tablet. Experts believe many people avoid obesity treatment because they fear injections. Foundayo may solve that problem. Unlike some older oral GLP-1 medicines, Foundayo can also be taken, with or without food, at any time of the day, and without special water restrictions. That convenience could make obesity treatment easier for millions of people. GLP-1 medicines mimic a natural hormone in the body. They help reduce appetite, slow stomach emptying, improve blood sugar control, and increase feelings of fullness. As a result, people often eat less and lose weight over time. Wegovy. Wegovy contains semaglutide and became famous for helping patients lose significant weight. Mounjaro. Mounjaro contains tirzepatide and works on two hormone pathways, GLP-1 and GIP, which may lead to even greater weight loss in some patients. Foundayo. Foundayo now enters the market as a convenient oral alternative. Clinical trials showed patients lost around 11 to 12% of body weight after long-term treatment. That may be slightly lower than some injectable options, but many experts believe the convenience factor could dramatically improve patient adherence. One of the most exciting developments in obesity medicine is that GLP-1 drugs may do more than help with weight loss. New obesity guidelines increasingly recommend medicines like Wegovy and Mounjaro, not only for obesity management, but also for reducing cardiovascular risk. Studies suggest these medicines may help lower blood pressure, cholesterol, inflammation, and risk of heart disease. Some GLP-1 medicines have already shown reductions in major cardiovascular events, such as heart attacks and strokes. For years, obesity was treated mainly as a lifestyle issue. But medical experts now recognize obesity as a chronic metabolic disease influenced by hormones, genetics, brain signaling, insulin resistance, and many other biological factors. That shift is one reason GLP-1 medicines are becoming central to modern obesity treatment. Despite the excitement, these medications are not perfect. Common side effects include nausea, vomiting, constipation, diarrhea, bloating, and stomach discomfort. There are also warnings about possible thyroid tumor risks in certain patients. And recently, the FDA requested additional monitoring data regarding possible cardiovascular and liver safety concerns with Foundayo. Another major issue is affordability. Although companies are introducing lower-cost programs, many GLP-1 medicines remain expensive. Reports suggest Foundayo may start around $149 per month for self-pay patients in the United States. Doctors emphasize that patients should never start these medications without proper medical supervision. For many people worldwide, access and insurance coverage remain major barriers. Some experts believe oral GLP-1 medicines like Foundayo could expand obesity treatment globally because pills are easier to manufacture, transport, and prescribe. Others caution that long-term safety and affordability still need careful evaluation. Whether it's Wegovy, Mounjaro, or now Foundayo, one thing is clear: obesity medicine is changing rapidly. These drugs are transforming how doctors approach weight loss, diabetes, heart disease, and metabolic health. But the conversation is no longer only about losing weight. It's now about improving long-term health and preventing serious disease. What do you think? Would you prefer a daily pill like Foundayo or a weekly injection like Wegovy or Mounjaro? Let us know in the comments. And if you enjoyed this video, don't forget to like, subscribe, and share for more medical updates and health news.